play,
Okay. Come on.
to work,
After I'm done speaking. Okay.
to visit, to breathe. Now is not the time to give up. We are stronger than this virus. When it's your turn, roll up your sleeve and stick it to COVID.
We lose Dr. Shahab?
What I miss is being out there, coming through the gate and getting ready to play. I missed the noise that Rider fans bring.
Yeah.
If I was talking to Rider fans, I would say, get your shot, be ready, because we're going to have a football season, and we need you in the stadium.
Lots of power outages happening, so then we can just dial into the dial-in number if that happens.
Oh.
If you ever had to look a child in the eye that's relying on you to protect them,
was in the link that came with Teams.
Yeah.
would you say, yes, I will protect you? And that's essentially it. I will get the vaccine, I will protect you, because you can't protect yourself. Because I will do anything at all costs to protect my daughter.
Start letting people in, giving them the...
Okay, if you're ready, if everyone's ready.
Getting the COVID-19 vaccine for me will be a huge priority. I want to do everything that I can to keep my staff healthy. It's really just the only option to resume normal life.
Walking through to the chair where the vaccine was felt like a hero walk. And I feel that everyone who is going to receive the vaccine is gonna get that feeling. You know, that split-second jab represented so much hope.
I have my sticker that says I did get my vaccination. I deal with COVID face-to-face every day, and I want to protect myself, protect my coworkers, and protect the patients that I do see.
We all get vaccinated, we'd be better off. Not only important, I think it's essential that people do it. We're all in this together. Once you realize that, it found it a lot easier.
Good afternoon, everyone. Thanks so much for taking the time to join us today. We have Minister of Health Paul Merriman, as well as Saskatchewan's Chief Medical Health Officer Dr. Shahab, and SHA's Emergency Operations Center Commander Derek Miller. I would just ask that everyone mute your audio and video. Following our opening remarks, we'll have an opportunity for questions, and if you can just use the raise your hand function, and then we'll call on you. Minister, your opening remarks.
Thank you very much. Good afternoon, and thank you for joining us. Before I begin today's COVID briefing, I want to join Premier Moe in expressing our government's shock and sadness at the tragic discovery at the Merriman Residential School on Cowessess First Nation. Our government will continue to support Cowessess First Nation and all Saskatchewan First Nations as they continue the heartbreaking but important work of finding more unmarked grave sites and exposing this dark chapter in our nation's history. Our thoughts are with all the families and the survivors of the residential school at this difficult time. Our vaccination program continues to move forward at a rapid pace. Earlier this week, we surpassed 1 million shots administered in Saskatchewan. 69% of all eligible residents have now had their first shot, and 32% have already gotten their second shot and are fully vaccinated. Starting today, everyone is now eligible for your second shot, as long as you are 4 weeks since 4 weeks have passed since your first shot. So if you haven't got your first shot, you can make an appointment today and then get your second shot before the end of June and be fully vaccinated by the end of July. Now is the time to get in. Let's do all of our part and finish this job so Saskatchewan completely can reopen in July and we can be fully protected. Today, we are reporting a record day for vaccinations, nearly 25,000 shots. That's more than 2% of Saskatchewan's entire population vaccinated in a single day. So great job, everyone in Saskatchewan. It's now very clear that the vaccines are working. Yesterday, we had our lowest number of new cases since October 18th, 2020. And today, our 7-day average dropped to 55. It's the lowest level since October 26th. But COVID has not gone away. There are still some new cases every day. And we know the overwhelming majority of cases of people who are not vaccinated. So it's pretty simple. If you're vaccinated, it's very unlikely you will get COVID, and even more unlikely that you will get seriously ill. If you are not vaccinated, there is still a very good chance you will get COVID at some point, and you may become seriously ill. So get vaccinated. There's absolutely no reason to wait. Everyone is now eligible to get their first dose and second dose. There are thousands of appointments available on the SHA website and clinics all over the province, and thousands more available at pharmacies throughout the province. We did experience a slight delay this week in our Pfizer shipment, so some of the Pfizer clinics had to be switched to Moderna, but that's okay. No matter what the vaccine you got in your first shot, you can either get Pfizer or Moderna on your second shot. They are equally effective. The road to reopening and getting things back the way they should in our province run through these vaccine clinics. And thanks to so many Saskatchewan people in doing their part, we will reach the last step of our reopening roadmap and remove all remaining public health orders and restrictions in less than 3 weeks on Sunday, July 11th. But if you're not vaccinated, you're still at risk. So please, for yourself, for the people who care about you, and for Saskatchewan, get your vaccine. And thanks again to everyone working at our vaccination clinics and everyone in Saskatchewan, now over 700,000 of you who have done your part, rolled up your sleeve, and stuck it to COVID. You're the reason we can reopen and get back to a normal in our province. Thank you very much, Saskatchewan. Dr. Shahab?
Thank you, Minister. So I would also like to start by expressing to the residents of Cowessess First Nation and all First Nation and Métis people who have been touched by the residential school system in Canada. This is an unspeakable tragedy that occurred over generations, and every Canadian must play a part to acknowledge and understand the gravity of such a loss. And I'd also like to express my condolences to the families and friends of the 7 Saskatchewan residents who have passed away as a result of COVID since our last briefing, June 15th. In terms of our case numbers, it's really important to recognize and celebrate the fact that our case numbers are trending down. Case numbers are below 5 per 100,000, where we want to be for the long term, even lower, as low as we can get. Test positivity is below 5%. And I think we absolutely need to see these case numbers remain low and trend even lower as we reopen further on July 11th. And to make things as safe as possible, it's critically important that we continue to receive our first doses if we haven't already received them, and complete our second doses with the first vaccine that's available once we're eligible 28 days after our first dose. So it doesn't really matter if your first dose is AstraZeneca, Pfizer, or Moderna. As soon as you're eligible, get the vaccine that's available closest to you. Right now, there's more Moderna than Pfizer available, and that's fine. 2 months ago there was more Pfizer available, so people who got first dose Moderna got Pfizer. Supply and demand varies, but I think it's critical that we complete our vaccine series. Second dose is critical to enhance the protection against variants of concern and make things even safer than they've been so far. In terms of the reopening plan, July 11th, we really do envisage that, we've seen a great second dose uptake in people, or great first dose uptake in people over 40, and as age groups are becoming eligible, the second dose uptake has also been coming along really well, especially in 60 and older. But for everyone, 12 and older, I think we need to continue increase our first dose uptake. And as the minister said, everyone now, as of today, is eligible for second doses as long as they're 28 days past their first dose. So really, there's lots of options available: drive-throughs, appointments through the SHA, appointments through pharmacies, other pop-up clinics that are becoming available. So it is really important that we stay the course, try to get our first doses, and then within 28 days, our second doses as quickly as we can. That'll make us enjoy the summer, and the higher our uptake is, the better of a fall we'll have in terms of COVID. Thank you very much.
Thank you, Dr. Shahab. Thank you, Minister Merriman. We'll now move to questions. I could just remind everyone to make sure that your audio and video are muted. If you do have a question, please use the raise your hand function and I'll call on you. We're going to start with Scott Larson from CBC.
Hi, can you hear me?
Yep, go ahead.
The first question is for Dr. Shahab. With the Delta variant cases rising in Regina or rising in Saskatchewan, and Regina has now more cases than Saskatoon again in active cases, are you concerned about that?
Thank you. So we are looking at our overall variants as a proportion of the total. So the Alpha variant remains the predominant variant. The Beta has not gone any further. The Gamma still is increasing, especially in the northwest part of the province and also in the southwest, so along the Alberta border. So we've been watching that closely as well, because that is also more transmissible. The Delta, of course, we have seen that in many countries, the Delta has surged and has, in some cases, delayed reopening. But it is important to recognize that even the Delta variant is covered well with 2 doses of the vaccine. So that is why it's critical that we don't delay getting our first dose as well as the second dose. And secondly, the Delta variant at this time is at 125. If you look at our website, 73 isolations in Regina, 25 in Saskatoon, and the rest scattered throughout the province. And what is important is that, all the other measures around staying home if you're sick, even though, public health measures will end July 11th, all the other things will stay with us, which are common to all vaccine preventable diseases. Stay home if you're sick, seek testing, follow public health guidance, which means that if you're sick, you have to stay home for 10 days. Close contacts who are fully vaccinated do not have to isolate. So I think that's another benefit of being fully vaccinated, that then there's no disruptions if you were a close contact. But if you're a close contact who's not vaccinated or partially vaccinated, you still would have to isolate for 14 days, even after the other public health measures end after July 11th. And I think those measures have really kept the Delta variant, levels low. But we have to be cautious, as we reopen even further. The best protection we have against the Delta variant is 2 doses and arms. But in addition to that, all the other public health measures will be critical as well.
You have a follow-up question, Scott?
Yes, I do. Thank you. What are you doing? This is for either the health minister or Dr. Shahab. What are you doing to increase first doses, given the fact Saskatchewan has now the lowest uptake of first doses among the province? Are we looking at more pop-ups or mobile, or how are we going to get more doses?
I can take that one. We've had an aggressive strategy in the last few weeks to be able to make sure that everybody has the opportunity. We've gone into schools to make sure that this was something that was added on, because it wasn't too long ago that it was only 18 above, and now we've moved into the schools with our vaccination program that was very good in our elementary schools for normal vaccination, and now we've moved that into our high schools. We've had pop-up clinics in various areas that we know that has lower uptake of vaccines. But we've also had clinics pop up in various locations. We've had walk-in clinics, we've had drive-through clinics. We've never had more vaccines available in our province than this is the time. This is the time we've had the most vaccines available, and we're going to continue to do that. We're going to continue to look at spots in the province that have not got fully vaccinated or have low uptake. And we're going to go in and work with those community leaders and make sure that they have the opportunity to express to their communities, whether it's locally within one of the major cities or in the far north, to be able to make sure that they understand the importance of getting vaccines. So we're going to continue this. When we hit our 70% and we get to July 11th, I want to make it very clear, this is not the end of our mass vaccination program. We are going to continue to go forward on this so we can get everybody in the province that wants to get vaccinated. So we are doing that. We're working with community leaders, we're working with schools, and we're also talking to the millennials that are in that generation of that 20 to 40 range to make sure that they're aware that getting a vaccine now is much better than getting a vaccine in a few months.
We'll go to Colton Weems with CTV.
My first question kind of just got asked. That would be my other one. But I know you mentioned that it's all right to mix Pfizer and Moderna, but just wondering when we might know when Pfizer will arrive in the province.
Derek, do you want to take that one?
Good afternoon. Thank you, Minister. Before I answer the question, I just want to acknowledge on behalf of the SHA the heartbreaking discovery we're all learning about at the former Maryville Residential School on the Cowessess First Nation. Also add that our CEO, Scott Livingstone, called on all of us within the SHA today to pause and reflect on this and also recommit to the Truth and Reconciliation Commission calls to action. In terms of the Pfizer, we did have a slight delay this week in the arrival. Historically, Pfizer has been very consistent in terms of arriving on Tuesdays and Wednesdays in the province, and we had a slight delay by a couple of days this week, which caused us to have to adapt some of the clinics. There are about 4,000 booked appointments that ended up needing to be adjusted to Moderna. Through that, looking forward, we do have Pfizer arriving today and yesterday, so we are continuing on with booked appointments for Pfizer doses, as well as other avenues such as drive-throughs and walk-ins and community pharmacies, of course. Looking forward through to the end of the month, we expect to receive our normal shipment at the end of June, and then a slight reduction for the first couple of weeks of July of Pfizer.
Did you have a follow-up question, Colton?
No, that already got asked. I'm all good. Thank you.
Great, thanks. Next, we'll go to Zach Becerra with the Star Phoenix.
Hi there. Thank you very much for taking my question. My first question is for Minister Merriman. We set a goal of 70% of residents 12 and older getting their first dose before we lifted the mask mandate. We did not reach that goal by June 20th. We still have not reached that goal, but we're lifting the mask mandate anyway on July 11th. What is the point of a reopening roadmap if we do not follow it?
Well, I think there's many positive points to the reopening roadmap. One is we needed to convey to the people of Saskatchewan what the importance was of getting vaccinated. And when we started our reopening map, we had it very well staged out in 3 stages to be able to make sure that those stages were 3 weeks apart, that people were getting vaccinated. It was dropping down by the age category of who was going to be potentially most impacted by COVID. We hit all of those thresholds. We were at 69%. We were that close to getting to that 70%. So we decided that it was best to be able to move that up so we can line everything up with July 11th. We will hit that 70% very quickly, probably within the next 3 to 4 days. And by the time we get to July 11th, we're going to be well past that 70% of 12 and older. And certainly we're going to be well past that 70% of 18 and older. You got to remember, we're also looking at, we want to keep some momentum going for what is happening with our second dose. We have a record day today of almost 25,000 vaccines that we were able to administer. We have more vaccines in the province, like I said, than ever before, and we're continuing to be able to get those vaccines out as fast as possible. We did hit our marks on all of our reopening, and we decided to move that one because we were so close. We wanted to be able to make sure that we could get everything lined up on July 11th. So I think it was critically important that we had that roadmap. And as you saw across the country, once we unveiled our roadmap, Many other provinces started looking at our roadmap and creating similar roadmaps for their provinces. So Saskatchewan was again leading the way on reopening.
Follow up, Zach?
I do actually, on a different topic. One consequence of the revelations at the former Maryville Residential School has been a lot of trauma for a lot of people in this province. We've heard about the mental and emotional health impacts of this. I'm wondering if the province sees a need to deploy specialized resources to address that, particularly since revelations like this may become more common in the months and years to come.
It's a very good question, and I personally reached out to Chief Delhomme last night and offered that please let me know if there was anything that the province can do to be able to assist with the healing process of this. He acknowledged that and said that he would be in contact. They have to start their healing process at their pace, and I think we need to listen to what they're saying right now. The province is ready. I've asked my deputy minister to have staff available if we need to go in and be able to provide some counseling or some support services in there. And if asked, we will certainly consider that and work with Chief Delhomme and the community to be able to help them heal.
Next, we'll go to Julia Peterson with the Canadian Press.
Hi. My question relates to the results of a survey conducted by the U of S called Taking the Pulse of Canada, where the survey found that 29% of respondents had broken at least one COVID-19 rule. And of those, about a fifth said that it was because the regulations didn't make sense. And that was the second most common reason reported after seeing friends and family. Does that raise any concerns for you about the clarity of COVID regulations we've had in Saskatchewan?
Well, I think the issue that I saw during the most of the restrictions that have been implemented since the fall, that there was lots of interpretations of that going around on social media and the rumor mill versus what was actually factually presented by Dr. Shahab, the SHA, myself, and the Premier, to be able to find out exactly what the restriction means. We were updating our ROSC plan, our Reopen Saskatchewan plan, sometimes on a daily basis, communicating that out through our business response team to the business community to make sure that they understood what was specific restrictions and requirements on their behalf. We tried to communicate this in a very clear way. We were having 2 to 3 times a week, we were having our media avails, getting that information out. Unfortunately, it's some of it got twisted on social media that wasn't clear and created some confusion, which people didn't need any confusion at that time. We tried our best to be able to communicate this in multiple ways through mainstream media, through social media, through media releases, through advertising campaigns. We tried to do that. If there was always that option to be able to dig into the SHA website that had everything very clear on what the restrictions were. So I understand there was some confusion, and I had to personally clarify some of the restrictions to people so they understood that. But the good news is they were asking questions because they wanted to make sure that they were adhering to the restrictions and the guidelines out there versus unintentionally maybe bending the rules a little bit.
Do you have a follow-up question, Julia?
I do, yes. Again, from this survey, it found that respondents from the prairies were particularly likely, compared to most of the rest of Canada, to break restrictions on indoor gatherings during the pandemic. Do you have any thoughts as to why that might have been the case?
I don't have any thoughts as to why that's in the case. I haven't seen the survey itself. I'm not sure what the scope of the survey was. I know you said it was from the university, but I'm not sure exactly how many people were done in Saskatchewan, what was the rural-urban split. I know in general people in Saskatchewan adhere to the public health guidelines because we did see when those public health guidelines came into force and we had to increase the public health guidelines, every time we increased the public health guidelines, our numbers either plateaued in the next few weeks or started to come down. So there was a good comprehension of that. There were some outliers, though, or some people that decided not to adhere to the public health guidelines, and we saw that. And they were either fined or warned that these are the guidelines, whether you like them. or you disagree with them, but these are the guidelines to protect everybody in Saskatchewan. So we know that people in Saskatchewan did a very good job of adhering to the public health guidelines, and I know they'll continue to adhere to the public health guidelines until that July 11th date.
Thank you, Minister.
Thank you.
We'll go to Murray Mandrick with the Leader Post.
Hello, are we going to hit 80%? And if so, when? And I ask that because today we're seeing 25,000 doses, which is fantastic, obviously, but they're almost all second doses. We haven't moved closer to that 70% range, or we're still within that 1 percentage point. We're seeing a horrible stall, I think, in the 30 to 39-year-old category. So I guess the question people are realistically asking right now is, have we maxed out in terms, or come close to maxing out in terms of the number of people who will actually go out and get doses? I obviously don't think we have, but what's realistic to expect now? Is it 80%? And if so, when do we get there?
Well, I'm not sure if we can actually put a date on the 80%, but we did have, I think, around 2,500 new doses today. So on first doses, so Murray, if that trend continues, that's a very good trend. If we can get more doses and we're getting, if we get 25,000 doses in a day and 10% of those are new doses, we're certainly going to creep up there to get to that 80%. I understand that that's an important number that's been thrown out there. Dr. Shahab has talked about 70%, Dr. Tam has talked about 75%. There's various numbers. But we also have to understand that people are going to get this throughout the summer. We're encouraging them to get it done now. And I don't think that there's a vaccine hesitancy between that 20 to 40 range. I just think people are busy working, or they're busy enjoying the summer, and maybe they're not quite understanding the importance of getting vaccinated as soon as possible. I think they will get vaccinated, and I'm encouraged that people are coming out still. When I went and got my shot last week, there was lots of young people that were certainly under my age that were getting their first shot. So that's encouraging. They get their second shot. It's going to help out overall, but we want to get to 80%. If we can get higher than 80%, we're going to keep pushing it.
Dr. Shahab, did you have a comment on the 80% target?
Yeah, thanks, Murray. So, I think obviously with the Delta variant, I know, many people have been expressing, even in the UK, that, going higher is probably safer because the Delta variant is more transmissible. So if you go from 70 to 80% first dose and then ultimately catch up with second dose, that's certainly safer. And we've seen that in the UK and other parts of the world, that the higher you go, the less of a resurgence you have. So I think from that perspective, our uptake for other vaccines in young adults, childhood vaccines is well over 90%. So there really is no reason why we can't aim for higher than 80%. And the 3 C's, I think, come up again and again. Convenience has never been better. Complacency, whenever there's pop-up clinics, people who don't have any hesitancy, but they never got around to it. And if they're passing by a site that's offering vaccine, people will get their first dose, will get the second dose. Again and again, we see how people, when it's convenient, and offered, even people who are not thinking of getting vaccinated, if it's in front of them, they will accept. So I think those strategies will be important. And in terms of hesitancy, again, I would say less than 10% of individuals may have strong reasons to maybe not get vaccinated. But even, it's important to ask yourself, talk to your physician, your pharmacist, your public health staff, what your questions are, have them answered, because there's time, there's vaccine available. And, I don't think I want to say that hesitancy is even something that's a permanent state of mind. I think given that the vaccines are safe, effective, given that the higher our vaccination rate, the better it is for us individually and for our families, our communities, our schools, post-secondary workplaces, the benefits to vaccination are so significant that, I think having a higher aspirational target and working towards that throughout the summer and even into the fall is going to be critical. I think, being able to travel, being able to keep yourself and your co-workers safe, yourself and your fellow students and staff safe in school or university, these are all, tangible benefits of vaccination. And And I would again say that very few countries in the world still have this privilege of getting vaccinated with both doses so quickly, and we should not deny ourselves this privilege. Thank you.
Follow-up question, Murray?
It's a different one and a different topic. My apologies, but I have to ask you related to today's sad news coming out of Cowessess. Is it time for the government to reestablish or review its relation to First Nations people, especially the Federation, in relation to child care and child welfare? There was considerable controversy in terms of past things government members have said and done that the First Nations people have been troubled with. Certainly yourself, Mr. Minister, when you were social services, the notion of the FSIN being called lobbyists in terms of their concern over child welfare did not sit terribly well. Have you thought of, in today and in light of everything, about how government can better define its relationship, establish that better relationship that I think you want to better things as an outcome of today?
Thanks, Murray. I agree that we always need to continue to work with our First Nation and Métis partners on multiple fronts, certainly childcare. That's why it was very important that Premier Moe, and very significant when Premier Moe apologized on behalf of the government of Saskatchewan for the 60 scoop. We've also been working with our Indigenous agencies, which Cowessess is actually one of those Indigenous agencies that we've been working with on childcare and the transition on C92. This is something that we're going to continue, and I know Minister Carr is certainly taking this up, and Minister McMorris on the intergovernmental affairs and working with the Indigenous communities. This is something that we take extremely seriously. These are the children of their community and they're children of the greater Saskatchewan community. We need to make sure that we're doing this right, that we're doing this in the proper way. And I'm very proud of the work that I was able to do with many Indigenous communities, including Cowessess, over the term that I was in social services, and certainly prior to that with various organizations like Saskatoon Tribal Council and other First Nation communities, to be able to build on the future, recognize what happened in the past, but build on the future to be able to make sure that we have a better inclusive community for everybody, either on or off reserve.
Perfect. Thank you, everyone. Seeing no more questions, I just want to thank Minister Merriman, Dr. Shahab, and Derek Miller for joining us today. That concludes our availability.